Assalamu alaikum and good afternoon to everyone. So we welcome all the speakers and delegates to TeleHealth webinar hosted by Dr. Sulaiman Habib Hospital. Let's give a slight introduction for the conference before I go to Dr. Taha for his introduction speech. So, as with any disruptive healthcare innovation, it takes time, validation, and right catalyst before it becomes fully embraced across the medical community. With the corona pandemic, the innovation is in the forefront, transforming the healthcare landscape and telemedicine. Since February 2020, telemedicine has grown around 43%, with telemedicine's current trajectory and rapid adoption rate, it has the potential to disrupt and redefine the way healthcare systems operate. To illustrate the impact of telemedicine will make in future, we ask healthcare leaders and telemedicine providers from multiple specialties how they anticipate the telemedicine reshaping the future of healthcare landscape. Therefore, we continue the regional specific telehealth webinar hosted by Dr. Sulaiman Habib Hospital in Dubai. We had like four great speakers which have agreed to participate in this webinar. And in the order of the speakers, we have Dr. Taha Sarnali, General Manager at Dr. Sulaiman Habib UAE. And second speaker, we have Ms. Laila Al Jasmi, Founder and CEO, Health Beyond Borders Dubai. Third speaker we have for the day is Dr. Aziz Yasiri, Head of ICU at Dr. Sulaiman Medical Group UAE. And fourth, we have Mr. Abdul Aziz Oniangi, CEO of SIP Air Ambulance. So we have almost like already 35 participants joining in, and more people are waiting. So I will hand over to Dr. Taha for his valuable.
Sorry, it seems that it's muted, so I'll repeat again. Thank you so much for attending this webinar. I think we have, as I said, we have the pandemic that affects the whole world, affect many type of our lifestyle and our way to handle things. And one of these aspects is the healthcare industry. And I'd like to introduce a concept that's used in Sulaiman Habib Hospital that to communicate with patients, especially with those patients who are at high risk of acquainting the infection. So we, as a tertiary level care hospital, we took all the precautions in order to protect our patients. And one of these precautions is to launch something called Al Habib Life Care. We already have a very well and advanced infrastructure in terms of IT, and we have a very advanced mobile app. And we enhance this mobile app by using the Habib Life Care, where the patients can use his mobile in communicating with doctors on a pre-arranged appointment for consultation and for refilling the medicine. Of course, this is also married to another steps we do by delivering medication to the patients at home, and also by sending our doctors and nurses for home care delivery, especially for those patients with special needs or those patients at high risk, all patients, patients on immunosuppressive, diabetic patients, chronically ill, duplicated patients. So instead of asking them to come to their doctors, we use this technology in a very good way to spare the effort of traveling to the hospital and the risk of exposure to infection. And with this advanced technology, we are able to communicate with patients on a daily basis about their healthcare status. And also we provide them with support by sending our doctors and nurses, and also by sending the medication to their homes. Moreover, it enhances our relationship with the patients in terms of counseling, supporting the patients concerned, especially for pregnant ladies who find it very difficult to come to the hospital to follow with their obstetricians, and also to deliver vaccination at home for the flu vaccines and for the children vaccination. So it's this kind of telehealth technology helped us in many ways. Number one, clinical care delivered without any delays. Social and emotional support to our patients at homes, especially during the quarantine time and lockdown time. Providing the patients with the easement in terms of management of his illness through comprehensive doctor patients web camera, and even we reached to a level that especially for certain specialties like dermatology, we use the cameras for a diagnosis and for prescription of medication, and to be enhanced with other services like home care, vaccination. So the outcome of clinical care is fine, and we never abandon the care despite the fact that the lockdown and the precautions that we are opted to take during the pandemic crisis. Number two, socially, patients feel always the doctors available, and the doctors are always at their fingertips, using the mobile app, opening the mobile app, ringing the phone, receptionist, arrive the patient, doctor is available, doctor can communicate. So the communication, social support, and also we should not ignore the financial aspect. During the lockdown, we have lost a lot of patients because they cannot come to the outpatients. This also helped to compensate for the financial loss for a private institutes like ours. So there are many aspects, and I think the whole world is going into this direction in order to limit the transportation to the hospitals and to the clinics. If the technology can solve this problem, I think it was a grace. At the same time, it was a huge development. We are proud that we in UAE have all the infrastructure that really help this concept of telehealth, and also we have the understanding of the regulator on the value of telemedicine. The legislation in UAE and also the regulators usually encourage the kind of telemedicine and encourage to decrease the travel time and the exposure risk of patients, especially those patients who are chronically ill or with special needs. Al Habib Life Care is available on our mobile app. It's also available through our website, and the patient is free to access it, book the appointment, see the doctor, and if the doctor needs him or her to come, they can come, and everything will be arranged. Thank you so much for this opportunity. This is my introduction, and I think the future is coming for the telehealth, robotic surgeries, doing surgeries from far distance. It's all part of this new concept on the mankind and on the human life. And again, I am proud of Dubai and of UAE, and thanks for the government of UAE who really supported us in this and provide us with all necessary infrastructure, especially with the introduction of the G5 now. Transmission become easier, resolution of photos become better, we can read the lab test, we can read the radiology reports and radiology images. The life become easier, and I think the future is for the life telemedicine. All it needs legislation, government that understand, something like UAE government to understand the concept and really encourage this concept. So thank you so much for this opportunity. That's my introduction. And I wish you all the best.
Thank you, Dr. Taha, for the wonderful introduction. Now we have the second speaker, it's Laila Jasmi. She will be talking about the point on telehealth AUA perspective.
Thank you, George, for the introduction. And thank you, Dr. Taha. It was a great insight from your good self of what's been happening in the telehealth.
We can hear you.
Can you hear me, all of you?
Yes, yes.
Okay, great. I was saying thank you, George, for the introduction, and Dr. Taha for your insight about the telehealth and the UAE. So I'm going to speak. Just give me some time to share. Okay, so I'm going to speak today about the impact of telehealth from the UAE perspective. So if we look at the bit of the backgrounds that's been happening in the UAE, we know that the telehealth became the gateway to how healthcare will be delivered in the future. The telehealth became very much indeed important in the UAE and the treatment tool, especially during the COVID-19 pandemic. And it has been due to the need to create a social distance in a safe environment and introduction of the reimbursement of a virtual visit, which actually had contributed to our healthcare insurance system in the United Arab Emirates. But we have seen that more than 50% of the hospital in the UAE using various or IoT-based solution, and approximately 90% of the doctors was using smartphones and medical apps to provide healthcare. The UAE government support the establishment of the telemat infrastructures and the advancement of telemedicine application. And this is which Dr. Taha has mentioned earlier, is that we were lucky to have a government that has support the development and the infrastructure of the information technology in the United Arab Emirates. The UAE has several companies offering teleconsultation, from independent telemedicine companies to the health insurers. Now, if we look at the benefits of telehealth, why do we need it? And why it was very much important to have this kind of a service in the UAE. To the patient, it was very convenient. It reduced the risk of infection, of course, because they don't need to come to a hospital atmosphere or a clinic atmosphere. Save the time and money, and efficient monitoring of chronic patients, those who are stabilized and they don't need to be frequently available in their visit to the hospitals or the clinic. For the physicians, expand the patient base so they have a tremendous base of patients that they can communicate with them around the hours from different parts of the country. Frequent interaction, which is the ease of interaction. So the physician are having more of an ease of interaction with the patient through these different telemedicine applications. Easy and participation and training. So it has actually provided, even on the level of the physicians, a lot of training tools that they can utilize from their office space. To the insurers community, it has reduced on the cost due to a decrease in the length of stay and readmission. Of course, if we look from the perspective of the insurers, we will see that for them, of course, will be a good make of money, because there are not a lot of claims that they would collect, and they are already having a lot of costs that they have contained. Enable patients for a better accessibility to the healthcare system and wider choice of a provider networks that the patient will have through their insurers to access when they are in need. If we look from the benefit perspective for the healthcare providers, it will decrease in the number of shows. We know that a lot of hospitals has a lot of issues to do with patients are booking appointment and they don't show, maybe due to some urgent matters or due to a traffic or due to other reasons. So it has decreased on the number of shows, even though it has upscaled and it is built up on the patient using the telemedicine application. Lower the admissions, the cost is being constrained, and expand the access to a remote and rural regions. Now, we have some of our smart providers where they have been able through the telemedicine to provide a more of a better choice for their patients who are actually in a far and rural area, where for them was of a hassle to travel and to come to see their physician physically at the hospital. So this was one of the things that the provider has benefited from of providing care for the patient at their home. For the telehealth vendors, it was a better utilization of a hyper-connected telemonitoring devices that they do provide. So it's given them a more broader perspective to provide it for their clients, and increase in the demands and adoption of a clinical decision support and remote monitoring system and telehealth services. So these are some of the benefits that I had shared with you for the different clients. Now, if we look at the UAE and how the developments of telemedicine that has happened over the years in the UAE, from the technical infrastructure, we had a consultation software suite, and the installation and the maintenance. Oh, sorry, I was thinking I was offline. Okay. So from the communication and the promotion parts, we have seen that the UAE government has spent a lot of communication messages, tips, promotion for the developments and the launching of certain services in the telemedicine arena. And this has helped actually on a lot of the awareness for the community to understand the new deployments of the different information technology system that's been used in the country. From the project management, we have seen a customized approach with each company to build a care pathway, planning and organizing and training and daily monitoring of the whole of the system being in place. Network of a trained health professionals, credentialed physician trained in the practice of a remote consultation medical protocols. These all being provided by different companies within the UAE in order to provide it for their clientele bases. So from here, what we see is that in the UAE, in the initial stage of the developments of the infrastructures of the telemedicine in the UAE, there has been a consolidated approach from the governments toward even the private sector and toward the vendors. So they all knew what was coming, the future perspective, okay, and they have been able to lay out the foundation. And this was very much indeed important. Therefore, we have seen that when the pandemic has happened, a lot of the healthcare providers was in a very good position in order to cope with what's been happening and how to communicate with their patient and to provide care and not to stop and deprive their clients from having access to the healthcare. Now, the impact of COVID-19 on the UAE telehealth. What has happened? The COVID-19 has significantly shifted the public policymakers in the UAE, and changes that we expected were years away have been implemented over the past 9 months in response to pandemic due to the need to remain attentive and flexible in responding to our current need and preparing for future policy change due to COVID-19. And this is which Dr. Taha has mentioned earlier. This is something that we have seen with the policymaker in the United Arab Emirates, that they have been in a position where they have been able to cope of what's been happening with the pandemic, encourage the regulatory perspectives to enhance more of a regulatory flexibility for the telehealth in the United Arab Emirates. Now, the mandatory health insurance and the government has tremendously support to rise in the penetration of the private health insurance player covering the telemedicine services. What we have seen in some countries which they have been impacted by the pandemic, that the health insurance has not supported the providing of telemedicine for their clients. And this is something that we had overcome in the UAE, and this is something that the government and the mandatory health insurance that has been in the UAE has supported it. In March 2020, the UAE Ministry of Health and Prevention has collaborated with Doom, which is a telecom company, for setting up the first virtual hospital in the Middle East for providing remote care to the patients who are actually in far areas of the cities in order to provide them with the healthcare services. In May 2020, the UAE Ministry of Health and Prevention also upgraded all its hospitals, outpatient clinic to a virtual, as well as many leading public and private hospitals in the United Arab Emirates. Now, if we all know the United Arab Emirates population, so there are 85% of the UAE total population are below the age of 45. So the use of mobile technology, laptop, tablets, has over than 90% penetration in the region. So which make it very easy in the United Arab Emirates to deploy the telehealth and the digitalization in healthcare. The utilization of teleconsultation has increased a multifold during the COVID-19. And this is something that we have noticed. One of the examples I would like to share is Al Jalila Hospital, which is a children's specialty hospital in the UAE, has done more than 75% of the consultation through telehealth. Not to forget the other healthcare provider also within the UAE, which reach up to more than 80 to 90% of their services digitalized. The UAE major telemedicine player in Abu Dhabi, for example, the telemedicine center services provide access to a trained physician to approximately 1.2 million of Daman enhanced and Thiqa card holder in the country. Now, if we look at the market size and the revenue, from the UAE perspective, the UAE government initiate in the healthcare is seeing in a shift which is focused from treatment to prevention through a remote preventive care, virtual hospital, and other technology. Now, the telehealth market in the UAE is forecasted to reach up to $553.5 million US by 2025, expanding at a CAGR of 25% from 2020 to 2025. And this tells you how much is this market is increasing and expected to grow. The highest growing segment within the telehealth will be the virtual visit market, which is expected to grow from $73.5 US million in 2020 to a $280.7 million US by 2025. So it will represent around 30.7% at CAGR. Now, virtual visit providers are going to attraction as an employer health plan have started funding these services as member benefits. So there are a lot of changes or shifts that has happened in the insurance industry where actually the employers has provided a lot of member benefits for their clients, for their policies in order to cope of what has happening during the pandemic of COVID-19. If we continue with the market size and revenue, we'll see that the total UAE health market is forecast to grow from $86.8 million US in 2020 to a $222 million US by 2025. So an increase of 20.7% for the mHealth market. Now, mHealth market growth will be stimulated, of course, by the increased utilization of smartphones, tablets, wearables, and medical grade apps. So if we have these telemedicine digitalized application more of an enhanced, it will actually impact the growth of an M market in the UAE, mHealth market in the UAE. The overall remote patient monitoring, which is called RPM market, is forecast to grow up to $15.5 million US in 2020 to reach $37.1 million US by 2025, which will be 16.7% at CAGR. So this is the remote patient monitoring. Now, and the demand for devices in the UAE will see the traction due to the upcoming virtual hospital and clinics. And this is why we are expecting there will be some growth into this market too. Now, if we look at the growth opportunity and the different UAE telehealth markets, from integrated virtual care to a telehealth vendors to a virtual clinics and hospital. So If we have an integrated electronic health record platform, it will provide 360 solution, which is a regulatory compliance, support all the types of teleconsultation, prescription, remote monitoring, and so forth. This is not new to the UAE market, because actually the government has laid out the foundation for electronic health record for the United Arab Emirates 10 years back. And we have seen that the majority of the healthcare, the big healthcare providers in Dubai Emirates and Abu Dhabi Emirates, they are mostly fully electronic medical record system in place. And this is due one, because they have heard about the government future vision, so they laid the foundation, and they are actually ready to be part of the government future plan. The electronic health record, we've heard the federal government that they had already supported the initiatives, and they already laid the foundation and the collaboration with the different health authority within the United Arab Emirates. From the telehealth vendors, the opportunity to develop singular mHealth solution that can integrate various platforms catering to a multiple user needs are extremely in demand, as most of the mHealth solution user often need to depend on a multiple app. Now, from the virtual clinic and hospital perspective, we have seen that the home care service market have shown a rapid growth in the UAE, providing comprehensive service to the patient while they are at home. And this is one of the service that has increased in the United Arab Emirates. One of the reasons, because some of the governmental health authority supported, so it had actually helped to grow up the service within certain emirates. Number two is that the health insurance system within the United Arab Emirates has supported the providing of these services. So therefore, we have seen some of this growth has been increased in certain emirates. However, we are aiming that when the federal health insurance scheme be in place, this kind of a service we're assuming is going to grow into other emirates in the United Arab Emirates. Now, smart city in the UAE will improve also the healthcare efficiency and the consumer experience due to reducing the waiting time and avoiding non-emergency visits, leading to a decrease in operational cost in the long term. And this is one of the things we have noticed in certain city, for Abu Dhabi city, for example, which they are launching their project into having a smart health city, which will help a lot into driving this market toward a new type of future healthcare service. The last slide of my presentation here, which I would like to share with you all, is the challenges. Of course, with any developments in healthcare, there will always be challenges that we will be facing. However, we should learn how that we can work around these challenges. So some of these challenges that we might be facing is the rapid social change and sustainability of the e-health plan. So unless we do have a legitimate regulatory system that's flexible to gain of changes that's been happening, then this is something that we will be facing. The risk identification and management, this is one of the major aspects that in any developments that we should be able to measure, identify, and put the plan of action for it. Medication management and compliance, which is very important. Whenever a technology comes in, we should have a proper compliance management for the medication and the abuse of medication too. Patient engagement, very much indeed important. Now, this will depend on the society, how we engage the society, how we communicate with our patients, with our community, for any change that we are to introduce. Comparative effectiveness analysis and the analytical tool to implement, to manage the core measures, the readmission risk detection, and the quantitative outcome. Integration, whether the technology, it is the problem, whether it is a people issues, whether it is the right time to deploy. So all these questions we need to answer, and we need to know if we are actually on the right path. The lack of the federal guidelines in the UAE act as a barrier for the telehealth players to expand their services to all Emirates due to a different regulatory requirements. And this is something that I had mentioned earlier, is that we have seen, especially in the Emirates of Dubai and Abu Dhabi, the growth of telehealth medicine and the digitalization into the healthcare. And this is due to, we have a legitimate and regulatory framework, flexible policies that has encouraged the growth of the telehealth within these two Emirates. However, we are hoping with the new launching of the electronic health record for the whole country of the United Arab Emirates and the collaboration between the federal government and the other health authority, is that we overcome this barrier and we see a future growth of the telehealth and the other Emirates of the UAE. Thank you very much, and I wish you a successful webinar.
Thank you, Laila, for your interesting insight with facts and figures on telehealth in the UAE perspective. So this gives the team working on telehealth more confidence to work in those lines. Now we have the third speaker for the day, Dr. Aziz Yazidi. We'll be talking about the topic of tele-ICU.
Hi, everyone. Can you hear me well? So I'm Dr. Aziz Yasri, consultant in critical care and internal medicine at Sulaiman Habib Hospital. I'm going to talk today about tele-ICU. First of all, I would like to thank Dr. George and Sulaiman Habib Hospital for organizing this event, and also to thank Dr. Taha for his introduction and support for this event. So tele-ICU, it might be different from the common telemedicine. It is well established before the telemedicine a while ago for many reasons. Tele-ICU, also known as eICU, which is very much like typical ICU workflow. The main difference...
Doctor, can you remove mask? So if you are alone in your office.
Can I remove what? Sorry?
Can you remove your mask if you are alone in your office?
Yep, that's fine. I'm just having another person in the office, so try to follow the rules. Okay, so go back to my presentation. So tele-ICU is also known as eICU, and is very much like a typical ICU workflow. The main difference is that a critical care physician is from remote area. There's not in-house. So the diagnosis and treatment of most critical patient in the hospital will be run by and managed by a remote intensivist through a technology like video conference or telepresence robot. That will make it possible for any hospital to have access to a critical care physician in their ICU department or emergency room or any floor in that hospital face-to-face within a minute. Why do we need the tele-ICU? One of the main reasons is shortage of the intensivists. These days, we have a lot of shortage and demand for intensivists. The other things is increasing in the aging population, and that's an increase will require more services, more ICU bed with a limited number of intensivists. The other things is the pandemic of COVID-19, which has a lot of impact. One of them is increasing the sick patient, the critical patient, more than the ability of the critical care physician to look after them. I mean, the international standard is one doctor will look after 10 to 20 patients a day. But during the COVID-19, we couldn't really fulfill this requirement. And in some places might be one doctor will look after 50 to 100 ICU patients. Therefore, the tele-ICU become really a must. The other things, the physician burnout from their experience, so they cannot really run and see all these numbers of patients. So tele-ICU will help them. And during the COVID-19 also, the tele-ICU has helped a lot to protect the service provider. So rather than be in touch with a patient, they can use the tele-presence robot to communicate with the patient, to treat the patient, and stay away from the patient, so avoid the contact and infection. And for many organizations also, having intensive care consultant during the night time is a problematic. Therefore, the tele-ICU has helped to solve this problem by providing one intensivist to run 2 or 3 or 4 intensive care unit, or even from a different place where different daytime, they have a day, they have a night here, so they can run it from different places when they have a daytime, while the ICU have a nighttime. So the role of the intensivist in tele-ICU, what we call the tele-intensivist, is really like any hospital ICU physician. So the tele-intensivist will start his daily ward round discussing all patients with the remote place ICU team. So they see the most acute patient first and start to solve the potential issues and challenges. Then we'll try to facilitate discharging patient or downgrading the patient from the ICU to a different ward beds. And the third category is the gray area, where the patient, they don't have really a clear plan. So the intensivist start or try to find the clear plan for these patients. In Habib Medical Group, we have established the tele-ICU in 2016. And it is running through 3 different ways of communication. It started with a phone conference where a doctor in the main command center at Riyadh communicate with the branches intensivist by the phone. Then that evolved to video conference. And recently we have really implemented what we call the telepresence robotic system to have a virtual ward round through that device. The command center, as I said, is located in Riyadh, Saudi Arabia, and Habib Medical Group in 2019 won the Guinness World Record as having the largest tele-ICU command center in the world, consisting of 796 beds in 7 different hospitals in Habib Medical Group. This is the current robotic device that we are using Habib Medical Group, and you can see it's clear picture, easy to be controlled from a remote area, and it's very helpful to do the job. I mean, with this tele-ICU, certainly there's a lot of advantages and benefit, but at the same time, there's also challenges. I think our main objectives from this tele-ICU in Habib Medical Group is to have a central tele-ICU command center, which is located in Riyadh. The command center consists of doctors, nurses, and IT personnel to help running this center. But certainly the tele-ICU nurses have a biggest role by monitoring the patient in the remote area through their devices, by documenting what is running during the round and teleconference, and also being the link between the parties. So the command center have a daily ward round in Habib Medical Group with the branches, where they provide the recommendation and support, and also they have a monitoring center there to monitor all patients in all Habib Medical Group branches, which will improve the patient care and safety. Also, the command center encourage all the branches in Habib Medical Group for early referral of any critical case rather than wait until this cases get complicated or until the intensivists come from the night during the day. So encourage the doctors at the branches to refer these cases ASAP, even 2 o'clock in the morning. And also encourage them to ask for a second opinion when they are in doubt, and exploring the expert advice when it's necessary and asking for an urgent help when it's required. So as I said, there's benefits and challenges, but certainly the main benefits of tele-ICU is the patients, because our aim, our target is the patient. So patient safety and satisfaction has really benefited a lot from this tele-ICU. How we can improve the patient safety? By early detection, through the monitoring, through the early referral, by asking for a second opinion, by discussing the decision, difficult decisions, so you have an early detection of critical situation. So then when you have the early detection, you can intervene also early to solve the problem, because the tele-intensivist on the command center or in the command center is available at 24/7. So they can provide really very early intervention to this critical problem. The other things is we have a central protocol that will help, because that's very beneficial, having all these tele-ICU in one institute. So having a protocol-driven practice of care, that will help a lot in be familiar with the protocol. Everyone is applying the same protocol, and that will improve the quality of the care to patient and the staff compliances. The other benefit of tele-ICU is supporting the junior staff, so they don't feel lonely, they don't feel away from support. When they need help, when they need support, is always available in the command center 24/7. Other benefits is really you having access to the expert opinion, because you might don't have any or you don't have the expert in your side, so the expert is available on the other side, so you can ask for an expert opinion, and sharing your difficult decision with the other branches of the command center. And other helpful also benefit from tele-ICU is the timely discharge from the ICU. I will show you a study just in a minute. How did the tele-ICU did help a lot by facilitating timely discharge from ICU and avoiding the long stay of unnecessary in ICU. Also decreasing the ventilator days and the long of stay of the patient in ICU. The last but not the least of the benefits is the financial, because you can use appropriate use of the resources to run the tele-ICU. You might have 7, 6, 10 branches, but you have only 5 intensivists. So you can use them in the appropriate way, and the proper way to run all these 10 branches by just a minimum number of intensivists. So that's really has a lot of financial impact and advantage. This is a multi-center control study done by Habib Medical Group between 2015 and 2017, where they compared 10,000 patients in Habib Medical Group before implementing the tele-ICU with another 10,000 after implementing the tele-ICU in the group. And what did they find? They found that there's significant decrease in the mortality rate after using the tele-ICU because of early detection, because of 24/7 monitoring, because of the expert opinion, because of the support, early intervention. All that did help in decreasing the mortality. Also, the study did show that the long of stay in the ICU has decreased by around 13 patients for every 1,000 patients. So that's also a significant improvement. The pressure source, by early monitoring, by early detection, by the advice they provided, also the tele-ICU has decreased the pressure source in the ICU patients. The readmission rate also has decreased after implementing the tele-ICU according to this study, and the DAMA rate, which is the discharge against medical advice, because the patient has more satisfaction, the quality of care is more, the support is more, so that will help decrease the DAMA rate. The only things that study didn't show any changes or improvement is the reintubation rate. So these are the benefits. However, there's also challenges for tele-ICU. Is that the patient's right. I think it might be the ICU patient is different from any other patient at home, where he cannot make a decision sometimes intubated or sedated. So they need to be told, might be beforehand. The confidentiality, because with the ICU patient, he is more exposed, is more fragile and sick. His dignity, you need to, especially during the robot device, you need to see him and covered. So all of that needs to be taken in consideration. The other challenges is the conflict between the local and international authorities and policies. For example, we are here in UAE, have a different legislation to what they have in Saudi Arabia. That's the reason sometimes we face some challenges by implementing the same protocol and the same policy that they're using in Saudi Arabia in UAE. So we need to modify that and make it more suitable to the local regulation. Using the right technology is not always easy to choose the right technology. And when you choose it, you need to know it is available in the other side. And the staff in the other side are familiar with it. And is it easy to run it or difficult? So all these are challenges. And accessibility to the patient's electronic health information. That's also not easy during the tele-ICU. Some hospitals, they don't have the electronic health information. It's still all in paper and handwritten. And some of the devices might be, is not easy to read all of these. And especially with the obligation and legal responsibility. The other challenges might be different ICU, they have different sort of protocols, especially when they are not in the same institute, and different sort of patient's care. That's make also another challenges in front of this tele-ICU. The staff might be not familiar with the devices or ventilator in the other place. So that's also make it difficult to deal with these devices. And the other thing is familiarity of staff themselves. So might be the staff in the command center not familiar with the staff in the branch ICU, and that's also make it difficult to deal with them, which is certainly is not as easy as when you work with the same staff, the same unit. You see them every day, you deal with them every day, you know their personality. So that's another challenges. The other things might be the clinicians in the remote places. They don't accept the tele-ICU for many reasons. We don't know why, and they don't see value might be of tele-ICU. So you need to educate them, you need to convince them, you need to listen to them and find out where's the problem. And so really, there's a lot of challenges, but we need to deal with them. We need to find a solution. So to reach to an agreement or solution and a progress. So this is my presentation. If you have any question, please let me know. Thank you very much.
Thank you, Dr. Aditya, for the wonderful insight into tele-ICU. So we will take the questions towards the end of the session. So we will move now to the next speaker, Dr. Abdul Aziz Indonian.
Good afternoon, everyone. Dr. John, hello? Can you hear me? Hello,
Yeah,
can
we
you
can hear you well. Yeah.
Okay, can you share my slide if you can from your end, Dr. George? Okay, good afternoon, everyone. A very excellent presentation. First, I'd like to thank Dr. Sulaiman Al-Habib Hospital for giving me this second opportunity to talk about medical tourism and telehealth. Most importantly, Dr. George, my good friend. Also, I'd like to thank you, Dr. Taha, for the brief introduction about Dr. Sulaiman Al-Habib. Ms. Leila, excellent presentation as well. And my namesake, Dr. Aziz. Thank you so much. George, can you please help me with the slides from your hand, if it's possible? You can share the slides for everyone to see. Well, a lot has been said about telehealth, and we all know what telehealth is all about right now. So fast forward for me, for those who are in the developing markets, the use of advanced telecommunication technologies to exchange health information and provide healthcare services across geographic, time, social, and cultural barriers. Now, can you imagine what healthcare would look like if clinical care was available anytime, anywhere, especially from the developing countries, like Nigeria, and the other African country, East Africa, and so on. Clinical care was available anytime, anywhere. Clinicians could obtain consultations with medical centers of excellence anytime and anywhere. Homebound patients could be monitored remotely anytime and anywhere, especially post-ops, medical education programs were available anytime, anywhere. I mean, just like what we're doing now. And this seems to me to be a very good and fantastic innovation, which is being pioneered by Sulaiman Al-Habib. No matter who you are or where you are, you can get the healthcare you need when you need it. This is what it says, And what's the need for telehealth in medical tourism? Clinician shortages, misdistribution of providers, rural and urban underserved, aging population, the travel time, cost, and hardship, delayed treatments, language barriers, clinical education programs, administrative meetings, especially the travel time, cost, and hardships, because it's been a lot of challenges, especially in the COVID period, for a lot of people to travel out of the country. Now, what are the benefits of telehealth in medical tourism? One of the significant potential benefits of telehealth in medical tourism is in improving the process and quality of pre- and post-operative care. There are several pre-operative telehealth applications. Baseline data can be collected remotely, pre-operative physical examinations performed, and patient education given easily. Anesthesiologists can perform teleconsultations, including remote physical assessment of the cardiovascular and respiratory systems, including the airway. Post-operative care can also be provided via telehealth after patients return home, with virtual follow-up visits. And one of the major challenges you have in medical tourism is, yes, it's not enough for any patient to come to destination hospitals, but post-ops, oftentimes managing post-ops becomes a very, very critical situation. So this comes in handy, with telehealth in medical tourism. Wound healing also can be evaluated remotely. Telehealth would allow surgeons to coordinate follow-up care with patients, local primary care providers. I mean, for the resident medical doctors, the surgeons can easily communicate with them, for post-ops. Developments in remote monitoring technology make it possible for post-operative home monitoring, potentially mitigating the risk of hospitalization or reducing the length of hospital stays in the immediate post-surgical period. Now, finally, telehealth offers the potential to improve the level of customer service provided to medical tourists. For example, pre-operative video conferencing would allow patients, family members, surgeons, and other key members of surgical staff to virtually meet face-to-face. Similarly, concerned family members who do not accompany the patient could stay in touch with the patient or traveling family members and receive briefings or updates from the surgeon or other key staff. This level of connectedness could also be used to improve continuity of care by keeping the patient's care providers in his or her own country involved throughout the pre-operative period. Now, what are the modes of the medical tourism telehealth strategy, especially from Nigeria and most of African countries, is to use the voice over internet protocol, Skype and so on. Those are the only things we can use here, so we're a little bit limited to more advanced technology. Other strategies that keep coming up in my own research is night hawking. Night hawking, telehealth also exists in the form of night hawking. That's what it says. The practice where cardiologists, radiologists, and even gastroenterologists interpret diagnostic test results and render their professional opinions and diagnosis for procedures that occurred around the corner in a nearby metropole or thousands of miles away with several international boundaries and oceans between them. These outsourcing providers simply supply a wide range of professional medical services in multiple locations throughout the world. If only it could be as easy as it seems to do this legally, ethically, and technologically. One of the barriers you usually have in such situations are money. In real practice, 7 deadly barriers exist for telehealth in medical tourism: money, regulations, the hype, the adoption, the technology, the evidence, the success. Those are very critical things. And some are actually new barriers that come up with transformation of healthcare by telehealth and its relationship with medical tourism. In any case, there are several challenges to that. In medical tourism healthcare, one of it, talking about challenges, the medical tourism telehealth strategy gives rise to several challenges. Among them, the primary considerations include, but are not limited to, the scope, reliable technology, applications and platforms, communications laws, medical examiner credentialing, privilege and licensing issues. The actual workflow process, the transfer of personal health information from us, from the patient to the physician, comes in also as a huge challenge. Medical records, photographs, tissue, pathology samples. These are very serious challenges in medical tourism, lab results and radiographic images. I've been faced with situations where you need to actually send in imaging, to abroad, for interpretation, so this also becomes a big problem. So we can start looking at it. Although telehealth offers great promise in improving medical tourism, several challenges must be addressed. There are legal challenges, regulatory factors as well. Even though right here in Nigeria, you don't have very stringent regulatory issues on telemedicine because it's not something that is common. It's just something we're trying to do by introducing, let's say, second opinion consultation, which makes sense. Since telehealth is relatively new, policies regarding inter-country telehealth practice are not well developed, and the legal environment must be assessed on a country-by-country basis. Many malpractice, insurance, privacy and security issues must also be considered. However, such risks can be avoided via proper patient consent and authorization. In addition, technical means are available to ensure privacy, including virtual private network connections. Currently, interoperability is most limited between electronic health record systems and biomedical monitoring devices. Standards development organizations and industry consortia are slowly improving system and device interoperability. Also, the network security issues can complicate inter-organizational video conferences because usually we have network issues here, not like the advanced countries. Finally, several human and organizational factors may be barriers to telehealth in medical tourism. Physicians and healthcare organizations may be unwilling to provide their services or facilities to support patients that travel to foreign countries for medical procedures. And this even happened a lot in medical tourism in Nigeria. I mean, physicians will not want to interface with the foreign doctors because they think they can do it here and they've been looked down upon. So health insurance companies may be reluctant to pay for services. Currently, we don't even have health insurance companies paying for services for telehealth. In conclusion, telehealth applications have rapidly expanded over the last 5 years and offer the potential to make a major impact on the improving quality, efficiency, and customer service in medical tourism. Advanced technologies enable the remote provision of healthcare services, no doubt, at locations most convenient for the patients and minimize travel for patients and family members. TeleHealth can lead to improvements, quality and efficiency of pre- and post-operative care, as well as continuity of care. Now, for me, I think the most important thing now is to support telehealth teleconsultations, especially coming from second opinion consultation system, which can be arranged anyway. Although there are several legal and regulatory, technical and organizational barriers to telehealth, they are quite surmountable, in my own opinion. Telehealth will play a significant role in the continued expansion and improvement of medical tourism. Thank you so much. I would like to take questions if there are any. I hope I've been brief enough and up to time. Thank you, Dr. George, for hosting me. Thank you.
Thank you, Dr. Oyengi, for the insight. Great presentation from the four speakers. So we will take a few questions from the attendees. So there is a question. I think it should be for Dr. Saha. So what should be the strategies to generate revenue from telemedicine in the long run?
Sorry.
Yeah.
Can you say the question again, please?
What are the strategies to generate revenue from telemedicine?
Well, as all the speakers mentioned regarding the quality and the communication tools that provided by telehealth has an impact on the financials positively, actually. First of all, we should always have some projections for the financials that can outcome from the making easy access for the patients. Number two, also, as Dr. Leila rightfully indicated, the no-show, which is a really might reach in some hospitals to 11, 12%, to reduce the no-show and cancellation of appointment. This is financial impact, positive. And also the third, which is very important, is the healthcare, the health tourism. And when we implement our Habib Life Care, we got consultation. Imagine we got consultation from UK, from Canada, from different parts of the world. Why? Because the people find it cheaper to go through this consultation from going to the doctor there. In terms of payment, in terms of easy, the technology provides easy access, full access, communication with doctors face-to-face, which really, our consultation, just an example, it's not the cash consultation is equal to $90, while if you go for any cash outside, it might be $200 or $300 consultation. This saving cost for them also, it's an financial gain for us. And also, with the healthcare tourism from different countries, it will help us to attract the healthcare, the people to come to Dubai and to UAE. We have a very fantastic facilities. I'm not only talking about Sulaiman Habib, so whether it's a government or even a private, we are proud that we have a very high-end infrastructure which is comparable to any hospitals in US and in Canada. I visited Canada and US, and I have trained in Ireland. I am proud that we have the latest technology here and the best doctors who are qualified in the West who are treating the patients here. So exposure also will invite patients to come and travel to Dubai for a treatment. And this access of the doctor, the patients can discuss the treatment plan prior to departure from his country to come to Dubai for treatment. Also, it provides the patients with more knowledge about Dubai, where they go, where they live, how they are going to come to get a treatment delivered here. So there are many financial benefits. It's endless, and I think it's an opportunity for everybody. Life becomes easier, healthcare becomes available at the fingertips of the people, whatever the far they are distant from Dubai.
Thank you, Dr. Taha. The next question will be for Ms. Laila Jasmine. One of the attendees is requesting whether the trend of telehealth is going to decrease after the pandemic. Ms. Laila,
Yes.
could you hear the question?
Yes.
The question is the trend of telemedicine is going to decrease after the pandemic. This is the question from one of the attendees.
Whether the need?
Whether the trend of telemedicine will it decrease after the pandemic?
No, I don't think so. If we are talking from the perspective of United Arab Emirates, and I believe all the country who went through the pandemic, the needs for telehealth will never be decreased. Actually, the figures I have shown in my presentation, it shows very well the growth in the market in the United Arab Emirates. And this is actually due to the future vision of the country that has been laid out 10 years back to grow the country into the information technology infrastructure from all the perspective. Healthcare is one of the domain, but it is actually deployed in all the sectors of the UAE government strategy. So I believe the growth in telehealth is going to grow more, and it will actually expand to digitalization into medicine. And this is actually also going to impact the other country as well, because there has been a lot of lesson learned from this pandemic and into the all sector, and especially the healthcare.
Thank you, Ms. Laila Jasmine. The answer is quite clear. The next question is for Dr. Aziz Yashiri. So the attendee is asking this question regarding tele-ICU. So the question is, in the tele-ICU model, there is some accreditation body for the tele-ICU model. This is the question.
Sorry, can you repeat that, please?
Accreditation body.
Okay.
Is there any accreditation body for tele-ICU?
Okay. No, there is no accreditation body for the tele-ICU, at least in UAE. So every institute, for example, Habib Medical Group, have their own policy and protocols for the tele-ICU. And the accreditation is really the same as when you get your license as an intensivist. But as an accreditation body specific for tele-ICU, I'm not aware of, at least in UAE or in the region. Thank you very much. You're muted.
I think Dr. Aziz is aware that we are connected to Saudi Arabia, but also we approached Dubai Healthcare City for accreditation purpose. And we went through a very extensive exercise to do the accreditation. I think we are at the final stage of this project to have accreditation for the because it's a new concept that connects two countries together. While in Saudi Arabia they have the same network, but here in Dubai we have different different protocols, and I think we are at the final stage of accreditation.
I think this question is also which are the specialities which is in demand for telemedicine?
Hello.
Dr. You are unmuted.
Can you say the question again, please?
Which are the subspecialties
Yeah.
in demand for telemedicine?
Well, and the first of all is the family medicine. Family medicine is in high demand for tele-ICU, telemedicine, telehealth. Second specialty, we have internal medicine and some sort of those who are really chronically ill patients, endocrinology, internal medicine, family medicine on the top. Yet we have also other specialties like dermatology. Also, we have some demands that comes from them. So to say the least, I think most of the specialty is there, but most common specialty is the family medicine.
Thank you, Dr. This is for Dr. Abdulaziz.
Yes, please. So I can't hear you.
So you have, can you hear me?
Yes, I can hear you now. Yeah.
Yeah, so the thing is, see, for the medical tourism, what are the challenges you face when you are trying to set up second opinion for the medical tourism?
Okay. Thank you, Dr. George. As you know, telemedicine is not something that is common here. So what we can actually narrow it down to is teleconsultations. Now, one of the major challenges is oftentimes even the patients, they get more satisfied to travel out of the country and have a direct interface with the physician. That's one. Okay. Now, for second opinion consultation, well, I guess that works well because, I mean, a patient wants to actually know, is it worth the while to actually travel down, or what I call hospital shopping, you know. Is it the right destination to come, or I need to go to Cairo, I need to go to Turkey, or thereabout. Now, that's one of the challenges. Also, the physicians, you know, for medical tourism, will, like I keep saying, will continue to try because most of the physicians also believe that, okay, I mean, perhaps it's cases where they can handle here. I mean, you know, well, with the COVID, I think it presents an opportunity to fast track, you know, teleconsultations, you know, telehealth. And I think the conference that we're having today makes a lot of sense, you know, for the current situation, you know, because of fear of travel, exposure to the pandemic, and so on. So we can actually say it starts from that. For regulatory issues, there are no current regulatory issues or regulations on telemedicine, you know. So we're still a little bit from some few steps back, but then we'll continue to move a little bit forward. So for me, those are just the basic challenges as well. Now, also transporting the results. For example, if you have oncology cases, like in Nigeria, you don't have a PET scan. So what do? You need to get the results from Ghana, which is nearest to you. Then you know, have to send that. So that becomes a lot of you know, scan results. It becomes a lot of challenges as well. Then connectivity makes a lot of sense for us here, even though the speed may not be as fast as you have it, you know, offshore, but it's workable, you know. But then there are no legislations, there are no legal, you know, requirements on telemedicine. It's still something that is still a little bit at the back, So, but I would rather narrow it to teleconsultation. So that's just what I can say.
Thank you, Dr. Yangi.
Thank you.
So actually, we have covered almost every topic regarding telehealth. Thank you, all the wonderful speakers, to share their insights. I thank all the participants to participate in Dr. Sulaiman Habib telehealth webinar. I thank Dr. Taha and Sulaiman Habib Hospital to host this conference on the behalf. And we will be putting up more online webinars on telehealth and related topics in the future. Thank you so much, and have a wonderful evening.
Thank you. Bye-bye. 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 Bye-bye.